Health is often shaped by what we see, but even more by what we don't. Hello and welcome to Health Digest, your go-to program for timely, relevant and people-focused health conversations. I am Ukeme Etuknwa. On the program today, we explore a range of health developments that cut across awareness, innovation and your everyday well-being. We bring you stories that matter. On that note, let's begin with our health news.
The federal government, through the Presidential Initiative for Unlocking the Healthcare Value Chain, PVAC, says innovative financing is key to accelerating healthcare industrialization and achieving Nigeria's universal health coverage targets. Speaking at the 10th Nigeria-EU Business Forum in Lagos, the national coordinator, Dr. Abdul Mukhtar, said the initiative is positioning the healthcare sector as a major driver of economic growth, investment and job creation.
In the healthcare sector, I think that the right kind of financing must be innovative. You have to think outside the box. This is a sector that, again, because of the social impact, the social orientation, you need to have some kind of blended activities so that the cost of capital will be lower. It needs to be long-term, so you need to find a way to blend it with grants, with donor money, but also with private sector money, because that's impact is the key. You need to also have the right kind of instruments.
Dr. Mukhtar explained that the federal government is implementing reforms to strengthen local pharmaceutical and medical manufacturing, reduce dependence on imports, and expand access to quality healthcare. He said Nigeria's life sciences industry has the potential to grow from an estimated $4 to $6 billion to as much as $20 billion by 2030, supported by strategic investment and policy incentives.
In our pipeline in PVAC, we have about 90 plus projects in the healthcare space. Most of the biggest challenge that we have is the bankability. So when I go to my brother here in BOI, he needs to see all the bankability, the business cases, the feasibility. So the kind of funding will have to provide development, how you prepare projects. You have to look at maybe working capital. You have to look at just outside the box thinking.
We must identify together the global gateway flagship projects of tomorrow and give a growing visibility to the quality and impact of our partnership. Because the truth is that the EU offer and the EU-Nigeria partnership are second to none.
A group purchasing organization and a manufacturing academy are among measures designed to attract investors and build local capacity. Dr. Mukhtar also commended the European Union for its continued partnership in strengthening Nigeria's healthcare ecosystem. He expressed confidence that deeper collaboration with international partners will boost local production of medicines and medical supplies, supporting the federal government's broader plan to achieve universal health coverage while creating a more resilient and self-reliant healthcare system.
Still ahead on Health Digest, two major health developments making global headlines. The World Health Organization and Africa CDC have launched a $518 million response plan to contain the Ebola outbreak in the Democratic Republic of Congo and Uganda. Bundibugyo strain, which currently has no approved vaccine or treatment. Also, scientists at Stanford Medicine have identified genetic variations that may explain why some people respond differently to the GLP-1 weight loss drugs such as Ozempic. These findings could help pave the way for more personalized obesity and diabetes treatment in the future. Now, to Outreach Edge, where we spotlight health initiatives making an impact closer to home.
For many individuals, a cancer diagnosis is still wrongly viewed as an automatic death sentence. The fear has created silence around symptoms, discouraging people from speaking up or seeking medical attention when early warning signs begin to appear. Health professionals say this dangerous misconception often leads to late diagnosis when treatment becomes more difficult expensive and less effective. Experts noted that several cancers, including breast cancer, cervical cancer, prostate cancer, can successfully be treated if detected early through regular screening and prompt medical checks. Medical practitioners are therefore calling for increased awareness campaigns to educate citizens on the importance of early detection and routine medical checks.
So I tell people that when you have cancer, people will tell you that this myth that goes around that when you have cancer, it's as good as your life is gone, blah, 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 and all those situations. But I tell people that the main key about cancer is that once you have an early detection, the chance of survival is good. People that have more of the version, people that diagnose at a very, very late stage, more of the stage 4 disease. But if you diagnose very early, actually, apparently there's a good cure for cancer. So it's not a death myth. When you have cancer, it's not a death myth. There are miracles that still exist, there are drugs that work to cure cancer. So it's not a death myth. So I advise people that whenever you go to screen for cancer test and you report it, just have it in mind that it is not a death sentence.
They stressed that symptoms such as unusual lumps, unexplained weight loss, persistent pain, abnormal bleeding, prolonged cough, or sudden body changes should never be ignored. According to health advocates, stigmatization also remains a major challenge. This stigma, they say, could discourage open conversations and prevent many individuals from seeking support or treatment.
I care so much about the well-being of people, and I intend to use my office as Miss Kogi International Ambassador to create awareness for cancer and to let people understand that early detection saves lives. Cancer diagnosis is not a death sentence. We need to remove that stigma, and that's why I'm here.
For the outreach here today, we hope to achieve more community awareness around cancer, because we've noticed there's a lot of stigma also around cancer. People are afraid to get diagnosed. People think that cancer is a death sentence. So it's a community screening where we'll screen for potential cancer cases. And then it's also awareness as well, where we teach early detection and where our doctors are also on site to screen patients.
Stakeholders are now urging governments at all levels to strengthen partnerships with non-governmental organizations and healthcare institutions in expanding cancer awareness programs across communities, schools, religious centers, and rural areas. They also emphasize the urgent need for subsidized cancer screening, diagnosis, and treatment to make healthcare more affordable and accessible, especially for low-income families.
The rising of the cancer issues is a threat indeed, and hopefully the government should be doing more of things like this.
What the government should do is partner with more international organizations and their local NGOs as well, so that we all bear the burden and then all come together to assist in the treatment.
They stated that with strong healthcare policies, increased funding, and public-private collaboration, many lives can be saved while reducing growing burden of cancer in society.
You're watching Health Digest now. We're looking at sexual reproductive health, where we spotlight important issues that promote awareness of our reproductive health matters. Stay tuned. Sexual reproductive health. Scientists at Cornell University say they may be closer to developing a breakthrough in male contraception. In a new study, researchers tested a compound known as JQ1 in mice and found it could temporarily shut down meiosis. The process that produces sperm, that is. The treatment effectively stopped sperm production during use, but crucially, the effect was reversible. Once the compound was withdrawn, sperm production resumed and the animals regained full fertility. Going on to produce healthy offspring, scientists describe the findings as a major step towards a safe, non-hormonal male contraceptive. While still in early stage, research experts say it could one day transform how birth control is shared between men and women. I hope you found that fascinating. Now we head to chat to the expert segment, where we hear directly from the voices on the field. What is the importance of elderly and aged care in Nigeria? Elderly or aged care?
Yeah, it is so important to care for the elderly ones. Whichever way you want to look at it, that's from spiritual point of view or from the moral point of view or life generally. I think elderly care should be taken very serious because from your childhood you must grow. You must become old. And it is even the prayer of everyone to be born, to grow, to be useful to the society, and to get aged before they return back to their creator. So certainly, when you become old, you are as useless as no one because your strength, you've lost it by serving the country where you find yourself. Therefore, taking care of them is not negotiable.
Would you say the moving culture of having your elderly parents and aged ones in the village is still something that is still happening, or is there any shift in that trend? And are there any needs for policies to change to adopt this, in your opinion?
Yeah, let me address your question from the point of my NGO that I represent. That is Mercy of God Elderly Care Foundation that I represent. We see it as a child of necessity because in Nigeria, the elderly one has been abandoned for long. There's no policy that is guiding the elderly ones. Take, for instance, we have Children's Day, we have even Egg Days, we have Women Day, we have Men Day, and whichever way you have, but you hardly hear the elderly days. And all of us are getting to that place. So if there's no policy for them, then we are advocating a policy that, we are advocating for policy to be made that elderly people should be taken very serious, and their issues should be attended to just like any other thing within the economy. Because whatever the economy is today, those you call elderly people that you abandon, they make it to be. So ultimately, in Nigeria, there's no space, there's no place, there's no care for the elderly ones, and we are working for it. And that's why we have a center at Mercy of God where these elderly people can be kept, or we have those who goes there to take care of, we call caregivers, yes.
Elderly care in general is about properly handling and fostering advocacy for older persons, for a healthy aging, emphasizing that healthy aging matters in our society, where witchcrafting and abuses are too high in our society. Using Kenyan issue concerning one lady who was accused of witchcraft because of aging. Now in our society today, we don't see aging as a blessing. We see aging as a witchcraft. When people are aging, we less talk about them, we less engage them, we less value them. So aging advocacy is all about bringing them to the limelight that they matters in the society.
What is the most important health need for the elderly, or need in general for the elderly?
Healthy aging, just about aging itself. Aging is a very concerned problem. Aging alone is a health issue because aging, you face dementias, your system starts failing, you are weak, you can't do so many things on your own, you become so weak to the things you can do before. So aging is a very serious health challenge that needs a proper guide for formal training to help them, guide them in their dementia issue, because they face forgetfulness, they face challenges of loss of memory, they face disability to things they can do which they cannot do. Looking at our elderly care home, Mercy of God Elderly Care Home at Caregiving, there we have one in residence. There you see the practical aspect of the aging where they cannot help themselves. We provide the necessary needs, feeding them, bathing them, and going to market, providing some dementia support, and as well providing them with healthy environment.
So the 15th of June was the Day Against Elderly Care Abuse. How do you ensure that when it comes to caretaking and caregiving, that the elderly's integrity is kept in check?
World Elderly Day Abuse Awareness Day celebration is a United Nations celebration done worldwide to recognize the impact of aging in some of our societies that are giving lesser concern to older persons. And the major concern on that celebration is to make sure that they get access to the proper health care, and government knows that these people have served the community, they have served the country, and they should be also recognized as senior citizens in the state, and they should be cared for.
Some policies that the government should put in place to support elderly management, as well as what your organization is doing.
Okay, thank you. Now, generally, in Nigeria, there is no specific celebration for older persons, which we have been advocating for them to include the policy that a day should be fixed where the older person should be celebrated. And as well, they will be taught, they will be given access to proper health care, and let the policy be on providing on every state a ultra-modern system of elderly care home where the need assessments are done, where the proper health cares are provided, and also where their lives are also secured. And their security management and the health policies which are focusing on health, provision of relief materials, and also proper health caregivers. Speaking to Nigerians, you know, our healthy aging, like I said before, Mercy of God Care Foundation is really implementing a very major aspect of the society, a major work, which yesterday we met some of the government officials, and our emphasis on let them put in place some trainings, seminars that advocates for older persons, and the person-centered activities that also look at proper caregiving, like what we are doing in our Mercy of God Care Foundation, looking at grooming caregivers. And we are talking to Nigerians at this moment that when your parents is aging, it is not, everything is not witchcrafting. They should understand that there are some dementia issues that are beyond them, and they need to consult organizations like Mercy of God Care Foundation and other partnered organizations like IFI Motivational Charity Foundation, Linkage for Humanitarian, and Help Age UK that are always emphasizing on proper care for older persons so that they will be guided, they will be taught on how to manage aging issues.
We have a center already at Caregiving precisely. In fact, we have a program coming up on Saturday, 27th of this month, which is precisely tomorrow, where we are going to have some program for for people to come around, see the place, and contribute to the welfare of the elderly ones. Whatever they contribute is not for anybody, but it's for themselves. Because whatever you contribute onto any elderly person today, you are contributing to yourself for tomorrow.
Thank you so much for that. You've made some very good points. However, I want to know, when it comes to the health aspect of the elderly one, are there any preparations made to take care of the elderly when it comes to the health challenges? And what health challenges would you say the elderly ones face that are biological and normal?
Yeah, thank you very much. Like I said, in Nigeria, there's no preparations. Even among families, there's no preparations. Take for instance, there are certain drugs that the elderly ones are supposed to be taking. There are certain food that they are supposed to be taking. But some of this food today, agriculture is zero in Nigeria. Those foods that we could, in fact, now as I speak with you, my NGO is working towards, with some agricultural firms, where those food, the type of food like rice, maize, some of that, there are some certain food that they needed. Today, we don't even have enough of it. And the farmers, because of the insecurity, they are not planting. The little one is very expensive. The family cannot even afford. Even to afford for the younger ones, talk less of the older ones. That's why the older ones are being abandoned. Even the type of drugs that they needed. it's not forthcoming, and when you see it, it is very expensive. So the care for the elderly ones is zero. We are partnering with clinics, hospitals, that is there, a healthcare. Then most of the time they come around, and we have a doctor. We have 1 or 2 doctors that render service to us on voluntary basis because of the concern he has. Comes around, look at the elderly ones, that the few ones we have for now. By the grace of God, after our launching, we're sure of getting more materials to start bringing and accepting, the elderly ones. Don't also forget, we have also started training the caregivers. Because the caregivers, we need more of them. That they could go out, people can access them to take care of the elderly one when they are not there. Because take for instance, when your parents are old and you are grown, you have your job, one is married, you have your family, the elderly ones are abandoned. That is why we're putting all this into position so that we can start, coming up with something that happens out there that most of us go out to sort for.
One final health update before our next segment. Researchers at ETH Zurich identified a previously unknown biological trigger linked to Alzheimer's disease and developed an experimental compound that blocks the harmful process in laboratory studies. It says that the discovery could open new pathways for developing future treatments for the condition. Now, if you love our news and updates, you can do one thing. Stay connected to our space through our social media platform, Ukeme on Air. This is on Instagram, YouTube, and of course on LinkedIn. Now, finally on Health Digest, we turn to our balance check segment for your everyday food nutrients, lifestyle habits, and how they impact the body when taken right or wrong, or the proportions. Let's break it down for you.
Water is essential for life. It helps regulate body temperature, transport nutrients, support digestion, and keeps the body's organs functioning properly. While some health trends encourage people to drink excessive amounts of water each day, experts say hydration needs vary from person to person. According to the World Health Organization, fluid requirements depend on factors such as age, activity level, climate, and overall health. Drinking too much water in a short period can overwhelm the body's ability to maintain sodium balance, leading to a condition known as hyponatremia. In severe cases, this can cause confusion, seizures, and even death. The key is balance. Stay hydrated, respond to your body's thirst signals, and avoid overconsumption.
And that's our program today. From global health development to community impact coverage, we've explored key issues shaping well-being across different spaces. Thank you so much for staying tuned with us on Health Digest. As always, stay blessed and not stressed. I'm Ukeme Etuknwa. Bye.